many questions I ask you.
Okay.
And I do not want to make this about me.
Okay.
I really don't. But I am talking on behalf of so many people my age, like clients and friends, and I'm just reading this new book, and it's called How to Menopause.
Oh, yes. Yeah.
It was so good.
Yeah.
And so, I'm not even sure if you do that kind of stuff.
I do currently offer men's hormone therapy right now, and I will be offering women's hopefully by the end of the year. Women's is a lot more dynamic. Every single course I take, every provider I speak to does things a little bit differently, and interpretation of those types of hormonal labs for women is so important. And I feel like each provider looks at those types of labs through a different lens. And so I am doing my due diligence, and I'm taking all kinds of different courses, classes, certifications, and I'm taking just a little bit of information from each one to come up so I can treat women appropriately.
So good.
Yeah, because thyroid, gut, and hormones are so mistreated in our healthcare system. It's honestly, the further I get into it, the more rabbit hole I dig myself into. It will almost upset you and make you angry of how gaslit women are over those symptoms.
The reason I got onto this book was because I was listening to one of the podcasts, and she was a guest on it or whatever. And she, back in 2019, so not very long ago, she said that she was an anchor woman for high-end news, and she started breaking out in sweat. Long story short, it was her hormone. And she was on vacation, and she got a text from her doctors, "You're in menopause. Any questions?" Left it and she's like, "Are you kidding me?" That's when she really dug deep into menopause. And so they always say you follow what your mom has gone through. And so I'm 51. My mom talked about it a little bit, but I look back at the age, that would have been when I was in high school. We don't pay attention to our moms back then. And it wasn't a thing back then. It was just like, it is what it is.
Like, you had it was a thing, and just people thought, everyone said that was normal. Those are normal symptoms, and they're not normal.
And finally, people are diving deep into it. And I am excited for my daughters coming up, that there are going to be so many things that they can take before they get to the point that I am in.
Correct.
I am now, I would like to say, out of menopause. No, you're never out of menopause. I think that how do they say that? When you're on the upswing?
Yes. Yeah, no, it's a good way to put it, yes.
Well, I haven't had period, but I had my ablation. So I can't tell, but I'm just, with all my side effects and stuff like that, I feel like I've done really well with it. But if I would have known the whole time that I've been dating Brad, my husband, we've been together 9 years. I've been perimenopause. He doesn't even know the real me.
Correct.
So how old would you have been then?
Oh, I started dating him when I was 43, 44. Okay. But they're saying anywhere from age 30.
Absolutely.
So
we're seeing it sooner and sooner with perimenopause.
My mom, I think I remember her going through menopause because she was just a raging bitch.
Yeah.
And she would agree with me. So that's not me being mean. I feel that way.
Oh, yeah. You feel the shift. Yes.
It's insane.
Yes.
And I guess I've just been blaming it on
you're tired.
Yeah, the kids. I've been on every antidepressant that you can think of. My gut has always been messed up.
Exactly.
Just all of that. My mom has suggested maybe it's just early symptoms or signs of your hormones shifting. I'm like, no, probably not. It's just the kids or whatever. But she's right.
And some of the things that they were symptoms, I think she stopped at 35. Every single symptom that she was saying, I'm like, oh, that was me going through perimenopause, and I didn't know.
Exactly.
So the awareness is here now, which is what I love. And so that's why I was just wondering if you did any,
I'm so excited. I feel like our healthcare system, what people want it's shifting. People want to take control of their health.
Well, let's just start from the very beginning. That was just me staying off camera, which I know Ashley probably got that all recorded, but I just wondered if that's something you could help me with, because I personally, so I have my HRT up there and I have not touched it because I'm not sure what I'm going to do yet.
Yeah.
What's that?
Hormonal replacement therapy.
Oh, I'm a huge advocate for it. So my name's Nikki Frey. I'm a board certified nurse practitioner. I've been a nurse since 2011. My background is all over the place, which is good. I feel like I've learned things from each area that I've been in. I've done ER, I've done Life Flight, I've done ICU, I've done oncology, I've done vascular surgery, urology, hospice care, palliative care. I started my own palliative care program in Wyandotte County.
You should see ChatGPT's message. I said, I'm going to be interviewing, and I put your Frey Services,
Oh
Nikki
my
Frey.
goodness, how funny. I've never done that. I'm surprised I've never done
It
that.
came up and said exactly what you said.
Oh, that is
and
so
I told
funny.
Ashley, I go, she's done so much. and
The beautiful thing in nursing is
because you get all that
you
experience.
do. And I
Something
think
a book can't teach.
Yeah,
you.
exactly. I think I got a little bit of from each of those areas. It shaped me, and I learned so much, but I also saw in each area real gaps in our healthcare system. It's honestly, if you talk to anyone that works in healthcare, I can guarantee they'll agree with me on that. In so many cases, our patients, they're seeing all these different specialists, and each specialist is like a silo. And this specialist is prescribing this medication, this specialist is prescribing this medication, and there's no real continuity of care. And there's real gaps where these patients are not getting to the root cause of what is going on. And so many times, especially now, people are getting frustrated with their family physicians. And it's not so much their family physician's fault. I really saw it when I started going through clinicals to become a nurse practitioner. You go in, my first rotation was in family practice, and you've got about 8 minutes max to go through everything with that patient. And it's not good for the patient, it's not good for the provider, and things are just falling through. Of course, these patients, they're frustrated, they're disappointed, and so they're yelling out, screaming for help. I have A, B, C, D going on. What does that physician do? Here's a prescription for this, prescription for this, and we're not getting down to the root cause.
Right.
It really started a fire within me, even in my own health. I did not have a single physician really get down to the root and ask the right questions. Not so much their fault, and I think that a lot of times patients, we put too much responsibility on the physician, whereas we need to be looking at ourselves as well and doing that.
I agree. I'm sorry, but the one thing is, if we don't know what to ask,
Exactly.
and how do you tell what are your symptoms?
Exactly.
Everything you
Exactly.
start, and but
Yeah.
that's why I think it's so great that people are starting to
It's shifting.
understand
Yeah.
that you don't have to live with this.
Correct.
You do not have to live with the hot flashes. and all that. So
So the main things that I am seeing where it should be the foundation of our health should be gut health, hormone health, thyroid optimization, and treating vitamin deficiencies. And those things are not being addressed whatsoever with your family physician. So if even one of those things is wrong, it's like an effect where they all get out of whack, and we live in such a toxic environment.
Right.
Our nutrition is horrible. We're always in our screens. That blue light and fluorescent lights they're tanking our hormones, especially for women, our testosterone, things like that. And when you get those little things even out of whack just a little bit, it's a spiral effect that you are going to see fatigue, lack of motivation, loss of libido. You are going to see anxiety, depression, and so that patient is going to that physician, hey, I don't want to get out of bed anymore. I'm feeling depressed. I'm feeling anxious. Here's an antidepressant, and that is just tanking their testosterone even further instead of getting to the root cause of what is going on. These medications are making it worse.
I genuinely have just thought that I am like a crazy
I was there. I started going on my own journey years ago. I wasn't the healthiest person. I was drinking a lot. I had a very unhealthy relationship with my own body. I was calorie counting, working out twice a day. What I was doing was I thought I was trying to be healthy, but I was doing more harm than good to my body. After having children, it just got worse. I went through 3 miscarriages, got myself into a depression. I was tired all the time. And then you're anxious at work. You have that loss of motivation. You have that loss of libido. So that's affecting your relationship, your marriages. And so I ended up finding a functional medicine provider, got a full hormone workup, which, mind you, family physicians do not test this because insurance companies won't cover it. So it is expensive, unfortunately. But what I found was my testosterone was critically low. My estrogen was off. My thyroid was not being optimized. I was severely deficient in several vitamins.
My mind is genuinely blown.
So many people don't realize
That's the test that I was telling you about.
It is, and that's how we started.
Okay,
Yeah.
good.
In 2022, I was still working at a hospital. I was working for hospice, and like I said, I had my own palliative care program. And it got to a point where once I realized, I'm like, oh my goodness, this is going on with me. I hear this all the time. And I feel very much that our society, especially social media, has taken a strong awareness to mental health, which is wonderful. I'm here for it. I love that. But what I think is the big piece missing is what is the root cause of that mental health, where you're feeling anxious, you're feeling depressed, and that is not being addressed. People bring a great awareness to, you shouldn't be ashamed that you're on anxiety medications. You shouldn't be ashamed that you're on depression medications. And you shouldn't if that is the appropriate treatment for you. And I'm here to tell you, for most cases, it is not.
It just can't be. We can't all be.
We can't all be on something. When we were growing up, none of us were on anything.
My husband he just got put on an antidepressant. And I'm like, actually, I was really excited about it because I was like, oh my gosh, maybe he'll be in a good mood.
Right.
I don't know anything about that. But an outsider looking in, we eat so unhealthy. He drinks so much caffeine, works way too many hours. There's got to be something else other than just throwing up.
Yep. It's our environment, especially for men. I'm so passionate about our men's hormone program right now. So I just launched it less than 2 months ago. Was our men's testosterone replacement.
Can we
therapy
take
program.
testosterone out of men?
Can we take it out of that? I'll tell you, I have not found a single man yet that has had too low. Every single man that I have tested has been critically low.
I had my husband tested because
And he was low.
And it was low on the end, but our doctor was like, I don't know what it was at 19. And I'm like, I knew him then. It's not the same.
So they probably said what?
Nothing, didn't give him anything.
And that's the story with everything. So how we were taught to become a provider, and insurance is what drives all of healthcare, all of our decisions for healthcare providers, that is why I no longer accept insurance. I don't want to be bound by those barriers.
Right.
I am not going to have somebody who has never seen my patient, never laid eyes on them, haven't heard their story, dictate how I treat them. I'm no longer doing that. So that's why I got away from that. So if a man goes to his family physician, gets his testosterone tested, and mind you, each lab tests things just a little bit differently, which that's a story for another time. They say insurance dictates that if a man's testosterone is at least 300, you're good to go. You don't need any treatment. I'm here to tell you that I want my gentlemen to be optimized between 800 and 1200.
Whoa.
That is what should be an optimal level for a man, not 300. If you are at 300, you are feeling like crap. And you are not going to have motivation. You're going to be slack. That is the most rewarding part of that program. Is every single man that I have had a consultation with, tested with, treated, every single one of them are having the same exact symptoms, same exact ones, and they've been dealing with anxiety, depression, and then all of a sudden we optimize their testosterone. They're like, oh my goodness gracious, Nikki, I feel wonderful. I want to get up. I'm doing better at my job, at my career. My marriage is better. Some of these men have come to me and they were having thoughts of suicide. It had gotten that bad for them.
So giving men more testosterone, is that going to make their libido want more?
Oh, yes. Yeah.
Okay.
What if we don't want that? We don't want that side of it.
Because I'm on the other side of it because I have no libido at all and I have my numbers up. Could you look at them?
Absolutely. So I'm on testosterone, game changer. I'm here to tell you I hope this is okay to say, if you are not horny, you are not healthy. That's what I tell people. That is
Very unhealthy.
I was
Me and my husband are very
people think, after kids, or I'm tired.
Our kids are like, oh my God, no, we're just too tired tonight.
So I went to the OB last week, and we could, just because I ran my numbers like a year ago, and we talked about the HRT, and then I thought about it. And then when I went back, I didn't know this either. She pulls up my thing, and so 2 years ago, I had no testosterone. When I say none, it's the lowest it can be.
Yeah.
My estrogen is the lowest it could be.
Yeah.
And what's the other one? Progesterone.
Progesterone.
That was it.
Yeah.
That was two years ago. That's why I say I'm pretty much, I feel like over it. So I absolutely have no libido at all whatsoever. My husband does, and it does. It causes trouble.
Oh, it affects you. Yeah, absolutely.
And at first I was like, oh, it's no big deal. But I don't want to be like that for the rest of my life. So when I was talking to her, I was like, so when does my numbers go up? And she's like, don't. Did you know that, Morgan?
No.
So I did not know that. Like, when your numbers go down, they do not ever go up on their own.
Correct.
And I was like, so I'm never gonna be horny again? And she said, she's like, you just won't get there on your own.
Correct.
Yes. Meaning, so this is the way I took it. When you're like in your prime and you just, I don't know, see a movie or whatever, you get that feeling inside that horny little, I don't know what.
Yeah, we don't.
You don't get
That doesn't happen for me anymore. I'm watching it, I'm like, good for you.
Yeah.
Good for you, honey.
But I'll never have that. However, I do have the ability to get horny by arousal and stuff like that. Okay. When you have all these other symptoms, menopause, you don't want to be aroused.
Correct.
Even by Brad Pitt. It doesn't matter. It's not. And my husband is so not jealous. He does not think for 1 minute it's because I want it like somewhere else. He don't give a shit. He's just like, I am a dude.
Yeah.
So Brad probably would never come to you because we don't feel like he has that issue. However, is there other things? Because I can see his, and he would never say anything, but his energy has gone way down and he gets tired. So,
So that,
and we just blame it on old. We're just getting old.
Correct. I think that's what our society has done is we have felt like crap for so long that we have compensated for it. We use it as a badge of honor. I'm tired. I don't want to do anything. And we like to complain instead of thriving. And so my husband, he was my first testosterone patient. And it was not from a lack of libido. He was good there, but it was other things. For him, he has struggled with anxiety, depression his whole life, a little bit of lack of motivation. My husband, he is a workhorse. And I could see that he had to push himself a little bit more. And my husband just turned 40. He lives a very active lifestyle. He's muscular. But as we get older, you put on the pounds. Not that he was overweight, but started on testosterone, I'm telling you, within 12 weeks, he was a completely different person. His anxiety was better. His depression was better. He lost weight. He has not changed anything with his physical working out more or anything like that. He lost weight, his visceral fat on his abdomen. He now has a 6-pack again. And it was all from the testosterone replacement therapy. We think that is normal as they start to drop, and that is not normal. So if a guy, some classic signs, people think testosterone automatically for a guy, libido.
We always associate that.
Yes, that is a big part of it. But honestly, the low libido is going to be a later sign or symptom of low testosterone. If you have fatigue is the big thing for my guys. Fatigue, lack of motivation, anxiety, depression, not being able to work out as well, not getting the same results from working out, gaining weight. Those are a lot of the signs.
It all seems like it all goes together, right? If you don't have any energy.
Oh, critically low.
Really? What is it?
441. I don't know what NG/T.
So I would also be very interested.
Great.
Yeah. So some family doctors will test the testosterone, but that is not even what I look at. I go by the total testosterone, but what you really need to look at is your free testosterone. So that number is that is called the total testosterone. That is what your body has, but A guy could have a testosterone of 500, but it doesn't mean that it is available for his body to use, if that makes sense. So what the most important marker to look at is actually the free testosterone. That is the testosterone that is available for a man or woman's body to use. And another marker that we really look at is called your SHBG. It's a sex hormone binding globulin. So I will find a lot of times that a man's testosterone may not be too bad. However, their free testosterone is low and their SHBG is really high, which means their body is making the testosterone, but it is bound up in that SHBG hormone. So their body is not able to use it. So then if I see that, then we have to let's look at other hormone markers to see what is the reason why it's not working well. I could see that I can look at a guy's hormones and say, hey, you've been on anabolic steroids in the past. You were using pain meds.
You can see everything they do.
Yes. It's your lab work. When it is interpreted appropriate, when you have somebody that is knowledgeable in this, they're looking at it in a different lens than a family practitioner. And so that is why it's so important to make sure that you go to someone that is looking at it through the correct lens. Hey, I can see that this is wrong. Let's treat this. Everything else is going to get better.
Oh my gosh.
So where does one, you can do all of it. You can order the blood work. You can.
Correct.
So somebody can just go to you. Do you have a website?
Absolutely. I could do in-office person visits in my office in Upper Sandusky, or I could do telehealth for Ohio residents.
Oh.
Yeah, it's changing people's lives. It's a type of rewarding that I never even realized. Like I said, I had one gentleman he was very honest with me. I'm having suicidal thoughts. I am so depressed. I can't maintain relationships. I have no motivation. I don't want to go to work. I've seen him in 12 weeks. He's a different person. People don't realize your hormones, your testosterone, it drives every single part of your life, your quality of life, your purpose, your motivation. It affects it all. So if you're not treating it appropriately, you're going to be feeling terribly.
So what happens to people that these like vaping and smoking and stuff, you're not allowed to be on testosterone?
I would recommend stopping. It's not a hard no, but it is, you are going to be, okay, so if we want to get into that.
Okay.
Yeah, you could cut out anything that you need.
Okay.
Testosterone replacement therapy, way back when it first started coming around, and I mean that this could be another soapbox for another time, but the FDA did put this black cloud around testosterone replacement therapy, saying that it increased risks of cardiovascular disease, which is not true. Not true whatsoever. Yeah, no, you could look at the Traverse trials. There are so many studies that show it can actually improve cardiovascular performance. Yes. So that is part of it, because anybody who smokes vape, you are going to be at higher risk of cardiovascular disease.
Want to go back to the HRT, but
yeah.
I know what a lot of people probably want to hear is about the GLP.
Yeah.
So you can start us how you got there and how it got to the point they did.
A super important question once we get into this.
Okay. So the very first service that I opened back in 2022 was medical weight loss. I'm extremely passionate about this because I feel that the stigma and the treatment of obesity there's so much misinformation and there is such a lack of education. I'm constantly researching, keeping up with the latest on GLP-1 medications. And so I think my algorithm is constantly that. And I have to stay off of Facebook and Instagram because the comments just break my heart that, oh, you were taking the easy way out. You just need to eat less, you need to exercise more. And that is not true whatsoever. I'm here to tell you that is not true. So yes, absolutely, movement of your body and proper nutrition absolutely should be the foundation of any weight loss journey, wellness journey, health journey in general. But people do have the disease of obesity, okay? That I'm here to tell you that we have hormones in our body. We have GLP hormones. They're found in our pancreas, our gut, and in our fat cells. And then we have receptors for those hormones in our brain. So Somebody who does not have the disease of obesity, those hormones and those receptors are supposed to be communicating with each other to keep your body within a certain limit. We are all born with a certain set weight point, and some people's set weight point is higher than others. Not everybody is supposed to be 120 pounds. Some person's 180. That is normal. That's their weight set point. And yes, if you are overeating, you're not exercising, of course, you are going to gain that weight. But if you have the disease of obesity, it is going to be so much more challenging for you because your regulatory system is dysfunctioning. And it is not, you may lose 5 pounds, but then those hormones are going to jump right back in and, hey, I'm not comfortable at this weight. And it's going to send you right back. You're going to, instead of you just lost 5 pounds, but you're going to gain back 7. And so then it becomes this awful cycle for these patients where, they struggle. And then
don't you think that's when they're like, I'll try this diet, or
Exactly.
I'll do the no carbs, or I'll do the
Exactly.
Weight Watchers. Every Monday I'd be like, shoot, what diet am I on again?
Exactly.
I'm
Exactly.
like, I couldn't remember from the night before after I ate my Whopper because it was like my last meal.
Yes.
Yeah, it becomes
And then
very
Monday I was
confusing.
like, oh yeah, I'm gonna do no carbs.
Yeah.
Until
It becomes
I did
a
it
very
later.
toxic cycle.
And then you get depressed because you then
Exactly.
failed again.
Exactly.
And then you talk to your girlfriend who she's succeeded on her, and you're like, God,
Yeah.
this really sucks. Why does this one piece of food have that much authority over me when I know I want to look better? And people are like, it just, how bad do you want it?
Yes.
And I want it, but
That's exactly it. It becomes a very toxic, unhealthy cycle. And if you have the disease of obesity, those receptors in your brain, people do not realize that food noise is very real.
Yes.
And I have had hundreds of patients say, I didn't even realize how much that food noise was controlling my life until these medications quieted it for me. Telling somebody with the disease of obesity, you need to eat less, you need to exercise more, is like telling somebody to hold their head underwater. It is not going to work. They are going to need to come up for air, and then they're going to start that cycle all over again, which is messing with their thyroid, their hormones, making things even worse. They're doing more harm than good by doing that. That stigma, if somebody is listening and you have been struggling for years, for decades, it is okay. It is okay to get help. So these medications, what we offer are the GLP-1 medications. I know everybody knows about them, but there is still a lot of stigma around them. So I wanted to help maybe clear up any misconceptions with these medications because I'm extremely passionate about them. The benefits of these medications are unreal. There's never been a class of medications that offers the amount of intense health benefits as GLP-1 medications. It's wonderful. So what they do is they actually mimic hormones that are already found in your body. So it actually it works with your body to help you lose the weight. And it does it by several avenues. It slows down your gastric emptying, which means it slows down how fast food is absorbed in your gut. So right there, you're going to feel hungry much quicker and longer. So right there, you have that decreased appetite right there. Secondly, it controls your blood sugar levels. So somebody who has a disease of obesity, when they get a spike in blood sugar, their body will take that excess blood sugar and actually turn it into fat, which is why you see a lot of fat around the midsection. This medication helps with that. When you're on this medication, you get that spike in blood sugar. This medication will help your body take that excess blood sugar and turn it into energy for fat burning. So especially somebody who has like insulin resistance, they are really going to struggle with losing weight. This medication helps treat that. And then thirdly, it actually affects your hypothalamus, which is the pleasure portion of your brain. So it will quiet that food noise. And like I said, oh my goodness, I hear every single day, oh my goodness, this is the first time in my life that I feel like I have control over my body. I didn't know how bad it was. I was constantly thinking about food and I thought that was normal. And it's not normal.
There's your other addictions too, like gambling.
Yes.
That was an important question because I have my husband would say extreme addiction to spending money.
Yeah.
And I notice a significant difference when I'm taking semaglutide when I'm not taking.
Yeah, absolutely. My online shopping went way down.
Yes, I have been off of it for a month now, and I will say I lost a good amount of weight when I was taking it, but I stopped and then I kind of started again, and my mom had some vials that she had kind of got to where she wanted to be, so I was like, oh, I'll just take yours. Neither time I've been on it have I ever put a full effort into changing my diet and or exercise, and I'm just not. I've told myself I'm not spending the money on it until I get
your mindset
the right
around
mindset.
it.
Yeah, it does take work. Yeah.
I am like going through money again. I'm never gonna have
Get that shot.
Yeah, it might be expensive, but it's saving you money.
This is how I need to present it to my husband too.
Yeah. So we actually have many patients on it. It's on in studies right now to be treated for alcoholism and substance abuse disorders. So I have many patients that I am microdosing on these medications simply because it decreases their alcohol intake. I have one patient in particular, his son is terminal and he has been an alcoholic, and he told me, I want to be clear-minded. I want to spend every moment being present with my family. And Tirzepatide helps with that. It greatly decreases his alcohol intake.
When I started my journey several years ago, I literally went from drinking probably every night, really to where the point was, is it okay for me to drink that many beers? I wasn't even drunk. That scared me too.
Yeah.
To none.
Alcohol isn't even appealing to me
It doesn't
anymore.
even sound good when you're taking that medicine.
But I was like, it was right when my daughter was getting married. And so there were so many things that involved cocktails and stuff. So I would walk around with one just because that's what it felt like. But I never really liked it. And that's how Brad is too. So I just thought it was because I didn't feel good.
No, it literally changes the chemistry in your brain.
I was on the semaglutide and I lost a lot of weight and I stuck with it, but I just didn't feel good. But I didn't want to admit it. Because I didn't want you to take it away from me, or I didn't want somebody to say, maybe it's not for you. So I'd be like, I feel okay. I felt horrible. I really felt bad. For the first couple of days, I think I got the Zofran one time, and it got to the point where it was like, okay, it's not that I don't feel good. It made me feel bloated and I just didn't want anything to eat. It was like, I should be hungry, but I'm not, but I need to eat. But I heard amazing things about Tirzepatide.
Tirzepatide.
And I was like, can you drink? Can you have a cocktail with that? Yeah. Can you have this? Yeah. What? And I was just like, started talking. I never even looked to the Tirzepatide in the beginning because I didn't know anything about it. I just went with what I knew and it helped me lose weight and I wasn't going to say anything. I have not felt better since I've been on the Tirzepatide.
Good.
If anyone out there is taking the semaglutide, I don't know if I'm allowed to say this.
No, I tell patients this all the time.
Switch over. I don't know if it's that easy. It was for me.
Do you know that's so funny?
Used to take it, I would be like, okay, I gotta take my shot today. I'm gonna go to a party night and I don't wanna feel like crap, but I don't wanna take it tomorrow because I'll be tired. The Tirzepatide has not done any of that. I love it. But then people obviously feel that way on semaglutide, right? Yeah. So it just depends.
Yes.
Can you explain?
Absolutely, yeah. So everyone responds to everything different. The main difference between the two, so semaglutide, that is a single agonist. So it only affects your GLP hormone. So on average, patients will lose about 12 to 15% of their body weight on the semaglutide. And yes, GI side effects, we are always very open and transparent about. This medication, it drastically alters how your digestive system works. So yes, it makes sense that you are going to feel those GI side effects. I will say for most patients will say they're pretty minimal, and it does tend to get better as your body adjusts to this. For a lot of patients, if they are feeling extreme nausea or something like that, we look into how they're eating and drinking.
Yeah.
This medication, it slows down your gastric emptying, so your body will be pulling fluid to keep things moving. So unfortunately, it's really easy to become dehydrated started on GLP medication. So we emphasize if you are not drinking 80 to 100 ounces of water a day, you're gonna feel like crap.
And why is that? Because on the semaglutide or the Tirzepatide, I drink my water. Actually, the water tastes so good.
Yeah,
Like I can't get enough of it.
Yeah.
Semaglutide, I would drink water and I would throw up.
Yeah. So
I would
say about 50% of our patients on semaglutide experience those bothersome GI side effects. I personally have only ever used semaglutide and I didn't have a single side effect. So everyone is so different. But if they're reaching out again, hey, Nikki, I'm meeting my hydration goals. I am meeting my protein goals. And sometimes patients, they really want fast results. And so they keep moving up on dose, which is not good. Not good. When you are not tolerating things well, that is your body saying, hey, I need more time to transition you. I'm on too high of a dose. But some of these patients are so desperate. They've been struggling for decades. They really want those results. So even if they're not feeling well, then it's heartbreaking to me. We look at that. We assess your hydration, your diet, your body movement, the dose that you're on. And if you are still having those GI side effects, let's switch you over to the Tirzepatide. The difference is Tirzepatide is a dual agonist. So it targets both your GLP and your GIP hormone. Because it affects that GIP hormone, we don't see nearly the amount of side effects with the Tirzepatide. The problem is the pharmacies and the manufacturers know that it's way more effective. Patients will lose on average on Tirzepatide 17 to 23% of their body weight, which is insane. So it's a lot more effective and way less side effects. It's actually pretty rare for one of our Tirzepatide patients to report any bothersome side effects if they're doing everything correctly. The problem is manufacturers know that, so they make it more expensive. But if somebody were to ask me, which one are you going to recommend? If it's within your budget, I'm always going to recommend the Tirzepatide. You're going to see better results. You're feeling better. That gives you more motivation to eat right, to exercise. It's just that
I feel like
effect.
The semaglutide obviously was not the right one for me. Could that have affected other things with me, like my mood or behavior? Not behavior, but I cried a lot more. I was a mess. I was a mess. Like, I had a lot of stuff going on.
Correct.
But Tanya brought it up to me because she goes, maybe you should talk to Nikki about this semaglutide, because she was reading it had something to do with your mood. Now that I'm on the Tirzepatide, is it Tirzepatide?
Tirzepatide. Yeah, I know what you're talking about. Yeah.
I am just wondering if it has a little bit of mood stabilizer, or if it's just because I feel so good. Like
I think it's a combination of both. I think with many patients, there's a lot of self-limiting factors, outside things. But yes, it does. These medications affect your hypothalamus, which is the pleasure portion of your brain. Yeah, a lot of our patients will say they have improved mood. But we have had patients that say, hey, I feel off. I feel whatever it is. We switch them to Tirzepatide. 9-day difference. So everyone is so different, and this is not a cookie cutter thing, and which is one of the main reasons I love the compounded version, because I have more control over the dose that the patients are on. You can microdose.
Can you explain what that is?
Microdose. Of course. We started this off as like a medical weight loss program, but it has more and more studies are coming out about the incredible benefits of this. So we have so many patients that are on this for autoimmune disorders, for PCOS, for insulin resistance, for alcoholism. And so for those patients, we're microdosing, which means I want you on the least amount of medication where you were still feeling the results, still getting the benefits of it. Whereas if you're on the brand name, it comes in a pen form, you're locked into that dose. That is over double what your body should get, but too bad, you're locked in on that dose. With the compounded version, instead of starting at 20 milligrams, let's start you off at 5 milligrams. We can start low, go slow. That is always what I want for my patients, is I want you on the least amount.
This is right in our town, 30 minutes away.
Yeah, definitely.
So excited.
Before this, I started this business when I was still working hospice and palliative care, which, oh my goodness, my heart just loved that so much. And it was you're literally helping people pass away with dignity and respect and around their loved ones, and helping them mark off bucket list items. And it was this intense reward. I got that warm, fuzzy feeling every single day. And so I almost, as this business grew bigger and I had to resign from hospice, I honestly should have resigned from hospice a year earlier because this business was getting bigger and bigger, but I just loved hospice so much. I loved it. But when I was afraid I was going to lose that, but this is a different type of reward. We are helping people live, which is incredible.
You're changing their lives.
I had my own issues with my body dysmorphia. I remember back, and I'm sure every woman you meet, I remember in 5th grade, that's when I remember the moment when a girl was mean to me about my body, about my hair. And ever since then, you have this unhealthy relationship with your body. I hated my body. I hated it. And I did whatever I could. I wanted to be what was on TV. Yeah, I always just said, I just want to be skinny. Yeah. Well, what does that just so, and now that I do not want to be skinny. I want to be strong, but I had that in my own mind, but I had no clue how many people felt this way until I started doing these consultations. Almost every day I'll cry during these consultations with these people because obesity or that hate for your body is so isolating. These patients just bawl to me, cry to me. I don't go on vacation with my family because I'm not going to fit in the airplane. I can't drive anywhere because I don't fit in my car. I can't go on a date because I'm not going to fit in there.
These great moments that people are missing out, all these memories because of weight.
Exactly. In our society, because people think that person just needs to eat less, needs to exercise more. Our society thinks if a person is obese that they are less than, but they're lacking motivation, they're lacking self-worth. One of the most heartbreaking ones I had was a patient came to me, she lost over 100 pounds on Tirzepatide. She was just sobbing to me. She said, Nikki, I'm treated differently at work. I'm able to maintain a relationship. And she said, the most heartbreaking part is people treat my children better now. It was just like a dagger in my heart because some people do that.
They look at overweight people and think that they just must not take life serious.
Exactly.
Or like
they're not taking care of themselves.
Yes.
If you truly understood the science and the struggle and the isolation that they are going through, you would look at things so differently. And it made me look at things so much differently.
What age do you recommend this? Or what is the youngest?
Okay, so I am an adult nurse practitioner, so I could see 16 and up. As of right now, our program is just 18 and up. But these medications are FDA approved for even starting at 12 years old if they have certain criteria. I see both sides of that. I've heard both sides of that, but I also, if somebody has that disease of obesity, they already had that regulatory dysfunction. Why are we putting them through that? Why are we not treating it right? It's not a rite of passage.
No, but with these younger kids, because can you imagine the confidence that some of these people could have had back then if this was known?
Once again, like even starting at 10 years old, we are seeing puberty starting much sooner. And a huge part of that, again, is our toxic environment, that hormonal disruption. The society is so full of endocrine disruptors, our candles, the lotions, the makeup, everything, our nutrition. And you are already, these little boys and girls at 10 years old, you're already messing up their hormones, which is part of the disease of obesity.
Is that why our menopause is so much worse than our parents?
Yeah, it's why it's starting earlier. You're seeing
no wonder my mom does not give me any sympathy when I say menopause. It's almost, I've been through it. Get over it.
It's like generational thing. If I would, again, they think it's a rite of passage. If I had to go through it, you had to go through it. And I do think it was that bad back then, but I think women just kept things in a lot more back then. You didn't want to look less than, handling it better. I'm handling the night sweats and the mood swings better than.
Or we want to be like, I had a really bad night sweat, and then they'll be like, oh, I did too. I'm like, mine, like, you had the worst. Mine made my fellow. I could ring measure.
Yes, exactly. And it's not a badge of honor. It's not.
When I look for what podcasts and stuff to listen to, because I follow probably 95% of just women.
Yeah.
And it'll be like perimenopause and what to expect, what to look for, what foods, what exercise. I mean, it is everywhere. And I just scroll because I don't want to know. I don't want to know because there's nothing we can do about it. Correct. And it's so not true. And I seriously just figured this out last night when I came across that podcast with the girl with the book, How Do We Menopause? And that's just crazy because I had my OB this week, and then I come across this, and I've got my HRT just sitting there waiting, and now I have you today, and I came across that book, and before I do start my HRT, I am gonna finish the book, because if there's other things that I can do and maybe not. No, I know I want to be on the HRT. I definitely know that, but I feel like after reading this book, at least I know what it's going to be doing to me.
Correct.
I don't want to take something just because they said to. I had no idea that testosterone helped with all that.
Oh my goodness.
I thought I was
game changer for me.
I thought I was just going to be growing a beard and getting a deeper voice. I'm like, how much deeper can you get from this voice? Acne. I'm going to get all that.
Yeah. Testosterone for me was a complete game changer. And
So what are the symptoms? Like,
for me, it was
do you
fatigue.
see that once I start taking a look at it, says you can grow hair, and
We'll say in the beginning, acne is the most common side effect because it does increase your sebaceous glands. You become a little bit more oily. So I'll be honest with that. I have noticed that, but I also tell patients.
do you get oily down other places too?
I do not, but I have had patients, especially my guys, tell me oily to the back, having acne on the back.
And you get oily down there. Does it help with?
I don't think that's the same.
No, but it's testosterone. No, I understand it. It's not the oily that I was trying to make a joke. Like I need lube down there. Like, it's dry.
Yeah.
Like, my body is so dry. Everything is so shriveled up. So if I take one step that's gonna help down there.
It can help.
Okay.
We're still trying to be scientific.
Whatever works.
Okay. So with the testosterone, though, you said if you've never had acne before, what could you still have?
Much less. I always say acne is the number one side effect for it. It's usually transient, goes away as your body adapts to it. But I always ask, did you have a lot of acne during puberty? If you have a lot of acne during puberty, you are going to be more prone to acne with starting.
Okay.
So, but I've struggled with acne my entire life.
See, and I haven't, because knock on wood, I never had to. And I'm just too old. I don't want to have to do pimple patches. All that stuff. I don't even know how to do that.
And so you may not experience it at all.
But I'm okay with a little bit.
Right.
But this is also something, if the side effects got too much,
Oh,
can you
yeah.
just stop it?
I'm stopping it. So if anybody has any bothersome side effects, we adjust either the dose or the frequency of what you're getting, depending on how you're doing the testosterone. I always recommend testosterone injections. They're the most cost effective and the most effective for your body by far.
What people are going to want to know is where can they find you?
Oh, yeah.
How do they get a hold of you?
Yeah. So we have a website, www.freyhealthservices.com, or you could call us at 419-504-5190. We're on Facebook. You can find us under Frey Health Services. But yeah, people ask, who can you help? And it's literally everybody. I have yet to have a single patient that I have done comprehensive testing on that there wasn't a significant issue going on. So people ask, where should I start? And it's always, for me, the foundation of your health is going to be your hormones. Please get a full hormone workup by somebody who understands it, knows how to interpret it, is looking at it through the correct lens. It's so incredibly important. How in our healthcare system, exactly, family doctors do not even test the correct thyroid levels. It is so frustrating. And your thyroid, if your thyroid is off even just a little bit, you are going to feel terrible. That is one of the main things that if you're really fatigued, having trouble getting out of bed, you need to check the appropriate thyroid levels, because that is so important. Your gut health is so important as well. We've tested patients. We had one of our most recent patients, we ended up getting over 100 parasites out of her. Parasites are a very real thing. Almost everybody has parasites. So
It just sounds really bad.
yeah. So that.
So
is
did you
important.
say you could treat 18-year-olds, 19-year-olds? Okay.
Yes. And your vitamin deficiencies. I see that so much, especially your vitamin D. So incredibly important. If you have low vitamin D, you are going to be depressed. You're going to have muscle aches. You're going to feel terrible. You are going to be tired. You're going to have gut symptoms. So if you just started this foundation, I promise you are going to feel better, because it is not our healthcare system. You go to the hospital, they are like firefighters. They're going to put out the fire, but you don't want to wait till you are on fire to get help. I want to be a construction worker for you. Let's build you from the ground up. Let's start at the basis and work our way up so that you're not just not feeling sick. I want you to thrive. I want you to have optimal quality of life. It's so important.
She said the dryness down there, that if it continues to stay dry, it more likely is never going to get moist again. That's how I took it. So do something about it now. Let's get that moistened again. Let's get it to the way it used to work. Then I also, in my book, said instead of being like, oh my God, I'm in menopause, it's like I get to go through menopause, because if you know the right way, it should be easier. Yeah. And they said there is a whole new other world on the other side. Yeah. I'm like, can be. Yeah. And so thank you so much for coming in.
Thank you for having me. I'm so passionate about this, so I'm excited to tell people.
Ashley's given me the finger, like a one finger. Okay. Like, we gotta go. But oh my gosh, you are going to be a fan favorite.
Oh,
and I wanted to ask
you
you real quick, if we had callers leave us comments and suggestions and ask questions, would you be able to answer them on here?
I love to educate patients.
Yes, and you're so easy to follow.
Thank you.
You don't use the big medical words.
I try. I think
yes,
I do try.
That was really good. Thank you so much.
Absolutely.